Hi, I'm Will Cook, President and CEO of Vail Health. I want to start by thanking the entire community for all that you've done to help us get through this COVID crisis. I have some good news to share with you today about the data that we're seeing here from the hospital that I hope will make you feel comfortable about where we are as we move from the first phase of this crisis to the next phase. So how did we get here? It's hard to believe that it was only January that we first started hearing about COVID in China. And while many people, I think, were hoping it didn't make its way to the US or that the problem didn't turn into the pandemic that it did, many of us knew that it was very possible. Accordingly, we started planning for it back in January. We developed a crisis task force long before it had hit our shores. We started stockpiling PPE. We started working on testing soon and early and as broadly as we could to try and identify early on who might have been exposed so that we could prevent them from spreading it to others. We started making changes to our facilities to enable us to handle the surge that might be coming. So much so that we think we actually prevented the curve, not flattened it, and have now been able to send some of those precious resources, be it PPE or staff, to some of our other mountain colleagues or even people in the front range. And because of that, I'm happy to tell you that as of today, we have only 2 patients in-house who have COVID, one who's active and one who's waiting to be discharged to go home. Again, I just want to emphasize that this didn't happen by happenstance. It happened because we prepared early. It happened because as a community, we came together to help one another, to get through all of these challenges and the sacrifices we've been making by staying at home. And because of it, we're in a really good position. As much as I know social distancing isn't easy, it was necessary. And while we wait for a vaccine, and while we wait for a cure, and they will come, we will have to figure out how we have sustained social distancing. But we also must figure out, how do we live in this new world order? So if you have any issues, healthcare related, please reach out. We will make sure we get you tested if it's related to COVID. If it's not related to COVID, if you have pain, if you have concerns around cancer, if you need to see your doctor, we are here for you. Please reach out. The longer you let these things fester, the worse that they can be, and I want to make sure you know it's safe to come back to us. So a lot of people say to me, Will, why was Vail a hotbed? Well, for those of us who live and work in this community, we know it's because of the millions of visitors we get each year to our ski destinations. And while we're grateful for all those visitors, we know it also increased the probability that we were going to be hit hardest. Thank goodness that our leaders, Rob Katz from Vail Resorts, and others in this community made the extremely tough decision to shut down the ski resorts. By the way, right as we were approaching the busiest part of our seasons. That was not an easy decision, but I tell you, it was an extremely important one in helping us minimize this initial wave. Having an independent health system has been extremely important in our ability to deal with this crisis. Having Colorado Mountain Medical be part of our family on the front lines, fielding calls, screening people, getting them tested, having urgent care centers throughout our valley enabled us to catch people early on and not have them come into our hospital. These, again, are all things related to having a broad, integrated healthcare system in our community that, in my opinion, really positioned us to handle this virus very well. So let's talk about the data. Let me explain a few things first. ER is emergency room. As you can see in blue here, these were our 2019 emergency room visits, so a year ago. When you look at where we were in 2020, this is around March 13th. Now, remember me saying Vail Resorts closed? That's when that happened. And what you can see is the volume of patients who come to our emergency department dropped off significantly. This is no surprise because many people come to our emergency room when they get hurt on the mountain. A lot of people, I think, assumed that it would have been the reverse of this, that we saw more patients in our emergency room because of COVID. But remember, we deliberately were keeping people out of the emergency room, pushing them to our testing centers, pushing them to our CMM doctors' offices, so that we would minimize the impact to the hospital to protect this very precious resource. But the bottom line is, we continue to see very few patients in our emergency room. And you're going to hear me talk about other areas where we don't see that many patients anymore. Our inpatient. So inpatient means if you come to the hospital, you're very sick and you need to stay overnight. We have our patient care unit. This is where most people go. We have our intensive care unit if you're really, really sick. We also have our family birth center. And yes, people were still delivering babies during this crisis, but we still had to be careful when they were there that they didn't get exposed. But what I really want you to pay attention to here is this bright red line, which as you can see kind of peaks out somewhere around the last week of March. And while we've worked our way down the other side of this curve, we're down to the 2 patients that I told you we currently have in-house for COVID. So we have plenty of capacity, whether or not it's in our emergency room or whether or not it's in our inpatient facilities, to safely care for you. So again, I can't emphasize enough testing early and testing often. This has been a big source of debate worldwide, across our country and our state, here in our county. A lot of people call me, email me every day, trying to be helpful, sharing with me great news about the new test that's come out, the rapid turnaround test, the antibody test. And while we're so grateful for everybody who's trying to help, I want to make sure you understand that until the FDA has approved any of those types of tests, and until those laboratories can make enough of them to send them to us, we continue to rely on our existing testing processes, which early on, when we were getting hard, may have taken 7 to 10 days to get the results back. We've now got that down to about 2 days, and we're going to continue to test as frequently, as broadly as we possibly can. But make sure, if you have any symptoms, and those symptoms have expanded, that you reach out to one of our providers. We can make sure that you get tested and continue to hopefully see those trends go down. Which, by the way, this data is very reassuring. This is the number of confirmed COVID cases in our valley, and I want to take a moment to say thank you to Eagle County. The Department of Public Health there, all of the commissioners, Jeff Schroll, Heath Harmon, Becky Larson, the whole crew has been at our side the entire time supporting us, including developing a website that enables you to go and understand what's happening real time in terms of the number of people reporting with symptoms, the number of people who tested positive for the test, the fatality rates. We took this from their website, hopefully so that it would be familiar to some of you. And again, what you can see is this peaking of number of people who've tested positive. Now, if you recall, on our data, it shows that we peaked out somewhere in the last week of March. And you can see the number of people testing positive was 2 weeks prior. Kind of makes sense, right? You hear about COVID having about a 14-day life to it. So 2 weeks after the number of people testing positive peaked, it started to show up in our hospital. Let me show you another look at that data. This is cumulative testing. So the gray line here represents the cumulative tests performed. The blue line represents the number of negative tests, and the red line represents the number of positive tests. This is a really important graph because what you can see here is 2 things. Number one, the vast majority of people who have symptoms and get tested don't actually end up having COVID. That's a good thing. But what also is really good about this data is you can see that the number of positives has plateaued out. In fact, when you look at the more specific data, you can see that we've tested 2,200 or so people in this valley. Again, that's roughly 5% of our entire valley. The rest of the country probably is about 2%. We've had just under 500 positive cases. And if you look at the case fatality rate of 0.84%, that less than 1% fatality rate in this valley is amazing. And it got that way because, again, early on, we recognized what was coming. We mobilized ourselves. We worked as a community to make tough decisions about closing the mountains, about staying inside, being away from loved ones. All of those sacrifices are paying for it right here. This is huge. This is a very big deal for us, and we're so grateful that we find ourselves in this position, but it didn't happen via luck. So how do we now start to focus our attention to a safe return? Unfortunately, there's not a silver bullet. It's not going to go exactly back to the way it was before, nor should it. We have to continue to remain vigilant. We have to continue to do the things that got us to this place, which is working with one another and supporting one another. So make sure you're following Colorado and Eagle County's public health orders as they revise them, and they will, but make sure you follow their leads. If you have any symptoms, or you're worried that you have COVID, please reach out to one of our providers. We will get you tested right away. If you're sick or not feeling well, stay home. If there's anything we've all learned from this, it's if you're not feeling well, don't expose others. Make sure you're washing your hands. Let's do this together. Let's continue to be responsible to support one another. Lastly, be patient. We've moved now from a phase of the initial impact to sustained social distancing. I can't tell you exactly what it looks like, but be patient, we'll get there. If you're feeling alone, if you're feeling scared, if you or a loved one wants to talk to somebody, please visit www.eaglevalley.bh.org. Thank goodness that this community, years ago, started working on addressing that behavioral health crisis. Thank goodness that we came together, law enforcement, EMS, healthcare providers, social agencies, family members, to develop Eagle Valley Behavioral Health. Thank goodness that we had this before this COVID crisis, because it is actually setting us up for dealing with what now will be the other impact of COVID, and that is people who economically are suffering and who are worried about what it means next. So we're here for you. Whether or not you have behavioral health needs, whether or not you have pain, whether or not you have oncology, we're here, it's safe. Be safe, follow these guidelines, and know that we're all going to get through this together. Thank you.